Welcome to today's video about early signs of blood cancer. Every year, thousands of lives are impacted by blood cancer. But what if we could spot the warning signs earlier? Recent research indicates a significant rise in blood cancer cases globally. But here's something crucial. Early detection can make a world of difference. Are you aware of the early signs? Fatigue that doesn't go away with rest, unexplained weight loss, or persistent fevers could be red flags. But there's more to it. Join us as we delve into the lesser-known symptoms, backed by the latest research. So, whether you're seeking information for yourself or a loved one, or just looking to stay informed, this is a journey you won't want to miss. Subscribe and join us on this informative and hopeful journey. Together, let's uncover the early signs of blood cancer and embrace the power of knowledge and hope. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. All right, let's begin our exploration of the early signs of blood cancer, starting with the first one on our list, coughing or chest pain. Understanding the early signs of blood cancer is crucial, and it's interesting to note how symptoms like coughing or chest pain can be linked to this serious condition. When we think of blood cancers, such as leukemia, lymphoma, or myeloma, we often expect symptoms directly related to blood, like anemia or bleeding. However, the reality is more complex. Coughing and chest pain in the context of blood cancer usually stem from indirect effects. For instance, in a study published in Pediatric Surgery, 2012, researchers found that certain types of blood cancer can lead to enlarged lymph nodes. When these enlarged nodes press against the lungs or airways, it can trigger coughing or even chest pain. This isn't your typical cough or occasional ache. It's persistent and doesn't seem to have a clear cause, like a cold or physical strain. Another aspect to consider, highlighted in the International Journal of Molecular Sciences, 2022, is that blood cancers can weaken the immune system. This weakening makes infections more likely, which can lead to symptoms like a persistent cough. What's important for you to know is that these symptoms alone don't confirm blood cancer. Many conditions can cause coughing and chest pain. However, if these symptoms are persistent, unusual, and accompanied by other signs like fatigue, unexplained weight loss, or night sweats, it's wise to consult a healthcare professional. Early detection is key in managing blood cancers effectively. Next, number 2, frequent infections. In exploring the connection between frequent infections and the potential early signs of blood cancers like leukemia or lymphoma, it's important to understand how our immune system is impacted. Blood cancers can disrupt the normal function of immune cells, making the body more susceptible to infections. A study published in the Acta Hematologica, 2021, showed that individuals with chronic lymphocytic leukemia often experience more infections due to weakened immunity. This happens because the cancerous cells crowd out the healthy white blood cells that are crucial for fighting infections. Similarly, research in Annals of Medicine and Surgery, 2023, highlights that in acute myeloid leukemia, frequent infections are a common early symptom. The rapid increase of abnormal cells in the bone marrow hampers the production of healthy immune cells, leading to this vulnerability. It's not just about the frequency of these infections, but also their severity and persistence. As a viewer, if you're noticing that you're getting sick more often than usual, or your infections are unusually severe or lingering, it's worth discussing with a healthcare professional. While frequent infections alone don't confirm blood cancer, they can be a significant warning sign, especially when accompanied by other symptoms like fatigue, unexplained weight loss, or night sweats. Next, number 3, fever or chills. Fever or chills are often overlooked symptoms, yet they can be key indicators of blood cancer. This link is highlighted in a 2020 study published in The Curious. Blood cancers like leukemia or lymphoma disrupt the normal function of blood cells, leading to a compromised immune system. When your body's defense is weakened, even minor infections can cause fever or chills. These signs shouldn't be dismissed, especially if they're persistent. Research from the Infections in Hematology in 2014 reveals that about 90% of patients with leukemia experience fever as an initial symptom. This isn't just a random occurrence. Blood cancers directly affect the bone marrow where blood cells are made. As cancerous cells multiply, they crowd out healthy cells, weakening the immune response. This makes patients more susceptible to infections, which often present as fever or chills. It's crucial to understand that these symptoms alone don't confirm blood cancer. However, if they're accompanied by other signs, it's advisable to consult a healthcare professional. Early detection plays a significant role in the successful management of blood cancers. Remember, your health is paramount. Paying attention to your body's signals and seeking timely medical advice can make a big difference. Next, number 4. Unexplained rash, bruising, or bleeding. Blood cancers like leukemia, lymphoma, and multiple myeloma can manifest through various symptoms, often subtle and easily overlooked. Unexplained rash, bruising, or bleeding are among these early signs, indicating something more serious than just skin-deep issues. These symptoms arise due to the cancer's impact on the bone marrow, where blood cells are produced. When blood cancer develops, the bone marrow is unable to produce enough healthy blood cells. This includes platelets, which are crucial for blood clotting. A reduction in platelets can lead to easy bruising or bleeding, often without any apparent cause. Additionally, certain types of blood cancer can cause an immune response leading to rashes. This is because the cancerous cells interfere with the normal immune function. A 2023 study published in BMC Cancer noted a significant correlation between unexplained hematological abnormalities, like bruising and rashes, and the early stages of blood cancers. This emphasizes the importance of paying attention to these seemingly minor symptoms. While not every case of bruising or rash signifies cancer, persistent or unexplained symptoms should prompt a medical evaluation. Remember, early detection is key in managing blood cancers effectively. If you notice such symptoms, it's not a cause for immediate alarm, but it's wise to consult a healthcare professional for a thorough checkup. Next, number 5. Itchy skin. Itchy skin, or pruritus, is a symptom we often dismiss as a minor annoyance. However, in some cases, it can be an early warning sign of blood cancer. When it comes to blood cancers like lymphoma or leukemia, the connection with itchy skin is not widely known, but it's an important one to understand. The reason behind this itching is quite intriguing. In certain blood cancers, abnormal cells can accumulate and release substances that irritate the skin. A study published in the Dermatologic Therapy in 2019 revealed that nearly 30% of patients with Hodgkin lymphoma experienced persistent itching. This kind of itch is different. It's more intense and doesn't get better with regular lotions or antihistamines. What's more, this itching often occurs alongside other symptoms, like unexplained weight loss, fatigue, or night sweats. It's these combinations of symptoms that should raise a red flag. While it's crucial to remember that itchy skin alone is often not a sign of something serious, if it's persistent and accompanied by these other symptoms, a visit to a healthcare professional is advisable. Next, number 6. Loss of appetite or nausea. When discussing blood cancer, it's important to recognize how subtle symptoms like loss of appetite or nausea can be early warning signs. These symptoms are often overlooked because they're common to many less serious conditions. However, in the context of blood cancer, they play a crucial role. Blood cancers, such as leukemia, lymphoma, and myeloma, can disrupt the normal functioning of the body in several ways. One key impact is on the body's ability to use and absorb nutrients, which can lead to a decreased appetite. A 2019 study in the Intestinal Research highlighted this, noting that metabolic changes in blood cancer patients often result in reduced food intake. Nausea, another common symptom, can be caused by an accumulation of waste products in the body due to impaired blood cell function. As these waste products build up, they can trigger the body's nausea response. Research published in BMC Cancer in 2023 corroborated this, showing a significant correlation between waste accumulation and nausea in blood cancer patients. These symptoms, while seemingly minor, can be indicative of a larger problem. It's crucial to pay attention to these signs and consult a healthcare professional for a proper evaluation. Next, number 7. Night sweats. Night sweats, those uncomfortable episodes where you wake up drenched in sweat, can be more than just an annoyance. In some cases, they're a warning signal from your body, hinting at deeper health issues like blood cancer. You might be wondering, how does this happen? Blood cancers, such as leukemia and lymphoma, can disrupt the body's ability to regulate temperature. This disruption is often due to the cancer cells interfering with the immune system and the body's normal functions. A study published in the European Journal of Hematology 2023 revealed that patients with lymphoma frequently reported night sweats as one of their initial symptoms. But how do you distinguish these sweats from the ones caused by a warm room or spicy food? It's the persistence and severity that matter. Blood cancer-related night sweats are usually more intense and occur regularly. They're not just about feeling a bit warm. They can involve completely soaking your nightwear in sheets, which is unusual. It's crucial to remember, though, that night sweats alone don't confirm blood cancer. They're a piece of a puzzle that might include other symptoms. If you're experiencing these signs, it's important to consult a healthcare professional. They can perform tests and give you a clear picture of what's going on. Next, number 8. Persistent weakness and fatigue. Persistent weakness and fatigue might not always ring alarm bells, but in the context of blood cancer, they're significant early signs that shouldn't be ignored. Let's dive a bit deeper into why this happens. Blood cancer directly affects the body's ability to produce and regulate blood cells. This disruption can lead to anemia, a condition where your body doesn't have enough healthy red blood cells to transport oxygen efficiently. It's this lack of sufficient oxygen circulation that often causes the fatigue and weakness you might experience. It's not just a regular tiredness. Patients describe it as a profound exhaustion that doesn't improve with rest. This kind of fatigue can impact daily life, making even simple tasks seem challenging. According to a 2023 study published in the Scientific Reports, up to 40% of blood cancer patients reported experiencing severe fatigue at diagnosis. Remember, these symptoms are nonspecific and can be associated with many other conditions. However, when persistent and unexplained, they warrant a closer look by a healthcare professional. Next, number 9. Shortness of breath. Shortness of breath is often associated with conditions like asthma or heart problems, but it can also be an early sign of blood cancer. Blood cancers affect the body's ability to produce and function healthy blood cells. This disruption can lead to anemia, where there aren't enough red blood cells to carry oxygen throughout the body. As a result, individuals may experience shortness of breath. A study published in the BMC Cancer in 2023 highlighted that about 44% of blood cancer patients reported respiratory symptoms, including shortness of breath, at the time of diagnosis. This shows that respiratory symptoms are more common in blood cancer patients than previously thought. The reason behind this is not just anemia. Blood cancers can cause the spleen to enlarge, which may press against the lungs, limiting their expansion and leading to shortness of breath. Additionally, some blood cancers can infiltrate the lungs directly, further impacting breathing. It's crucial to remember, shortness of breath can have many causes, and not all are linked to blood cancer. However, if you notice persistent or unexplained respiratory issues, it's essential to consult a healthcare provider. Next, number 10. Swollen, painless lymph nodes in the neck, armpits, or groin. Swollen lymph nodes, particularly when they're painless and located in areas like the neck, armpits, or groin, can indeed raise concerns about blood cancer. This symptom is often linked to lymphomas and leukemias, types of cancers that affect the cells of the immune system. The lymph nodes swell because cancerous cells can accumulate in these nodes, disrupting normal lymph node function. A study published in the Journal of Clinical and Experimental Hematopathology in 2018 highlighted that swollen lymph nodes, especially when they persist for weeks without signs of infection, should be evaluated. Lymph nodes are a critical part of your immune system, acting as filters that trap harmful substances. When they swell painlessly, it's often a sign that something unusual is happening in your body. In blood cancers like Hodgkin and non-Hodgkin lymphoma, abnormal lymphocytes, a type of white blood cell, can accumulate in lymph nodes, causing swelling. Similarly, in leukemia, abnormal blood cells can cause enlargement of the lymph nodes, spleen, and liver, leading to swelling in various parts of the body. It's crucial to remember that swollen lymph nodes are not exclusively indicative of cancer. They can also swell due to infections or other benign conditions. However, if you notice persistent, painless swelling in these areas, it's advisable to consult a healthcare professional for a thorough evaluation. Early detection is key in managing blood cancers effectively. As our journey today comes to a close, we hope you found a new understanding and hope in the fight against blood cancer. Remember, the signs we've discussed could be the first step towards early detection and effective treatment. Armed with knowledge, we all have the power to make a difference, whether it's in our own lives or in the lives of those we love. If you found this video informative, please consider subscribing to our channel and sharing it with your friends and family. Your support helps us spread awareness and provide valuable information. Don't forget to like, comment, and share your thoughts or experiences. Your interaction could be a beacon of hope for someone out there. Stay tuned for our upcoming videos, where we'll dive deeper into health, wellness, and the power of medical advancements. Together, let's embark on a journey towards a healthier, more informed tomorrow. Thank you for joining us today. Keep seeking knowledge and stay hopeful. Until next time, take care.